And looking back, it's interesting to see, and I credit the member for Bristol South, now Minister, who spoke on this debate in January 2022, and she said, I quote, "Our constituents expect us to see guidance and perhaps be part of scrutinising it, raising objections and problems and improving it. That is the role of a Member of Parliament." And I think we've seen that exemplified here today. And I'd like to pay credit to the member for Beverley and Holderness for all he's done to raise this up, but he was actually trumped by the member of Thurrock, who I pay tribute to for her ability to speak so openly, so personally, and so informed about the issues that is at hand. The Shadow Minister at the time also closed by saying, "This is an example of how Parliament and the proper role of MPs can be made real. That's only a good thing for our constituents," and I agree entirely with her then. So turning to the debate itself, it's unusual to have unanimous feelings from across the House, but we've heard that here today in the debate, and it's an accolade to everyone that we've got this far, but there are still some things that are outstanding, particularly two issues: the progress of seeing the guidance and ensuring they're accurate and effective. It's important to ensure this guidance is robust and reflects the needs of the community. We don't want to rush publishing the guidance so to make sure that key issues aren't addressed, because it would undermine the efforts of the last 3 years and fail the very people it's aimed to support. Now, my former colleague who's been mentioned here, Sir Liam Fox, who put forward the private member's bill, has written to the chair of the Health and Social Care Committee about these reforms. And with your permission, Chair, I'd like to quote some extracts. He said, "When the House of Commons unanimously passed the Down Syndrome Act, it felt like a real dawn had arrived for those with Down syndrome and their family. We were promised new government guidance covering health, education and social care that would phenomenally improve service provision and provide accountability to service users." He then said later on, "Despite repeated promises, we have not yet seen the formation of an effective cross-ministerial task force. There's been little ministerial engagement with stakeholders, with many identical letters being sent out in response to demonstrably different queries. Now, 3 years after the legislation reached the statute book, this is completely unacceptable." He then finished by saying, "I believe that it is now time for both ministers and officials to be held account for the lack of progress and produce coherent guidelines, something that is regarded as a betrayal by many of those who were so encouraged and inspired by the passage of the Down Syndrome Act itself." So therefore, to echo many of the sentiments held in this chamber today, I have some gentle questions about the guidance. But it was interesting to hear the letter has been sent out, and I welcome that from the member from Mid Cheshire, and I wonder if the Minister will be able to take that, maybe a copy of that letter could be put in the House of Commons library for the public and us to all see. So the first question, can the Minister clarify if the updated guidance will be published, and if so, when? Secondly, would she commit to holding a debate or a statement on the guidance to have it laid before Parliament? Thirdly, how will the government monitor compliance with the guidance when it is published? To help the above, the National Down Syndrome Policy Group, who drafted the original Down Syndrome Bill and worked with Mr Fox and previous ministers to support the journey through Parliament, have been trying to engage further with ministers. They've highlighted to me multiple requests to meet the APPG for Down syndrome, the policy group and MPs, but have yet to be successful. So I would again echo the call. Would the Minister commit today to her fellow Minister meeting with the policy group and the APPG to follow this up? And getting close to the end, moving on to the theme of World Down Syndrome Day, which is indeed on this Friday, it's improving support systems. Now, we know with the growth of life expectancy for people with Down syndrome, access to social care is going to be critical. Therefore, can the Minister confirm whether the needs of people with Down syndrome will be considered in the first stage of Baroness Casey's commission into adult social care? And with the government's 10-year plan in production, could the Minister outline how Down syndrome will be addressed in the context of this plan? I look forward to hearing from the Minister about how this government will build on the foundations of the Down Syndrome Act and about the strength and enabling of support. If we see it through this prism, the world shines brighter when we see people for their abilities rather than their disabilities.